The role of government in public health. We are facing these days some of the biggest challenge humanity has ever witnessed. One of them is obesity and the risk of cardiovascular diseases, and both of those are interconnected, and here individuals have a limited role and government has to play a big role. If you see the etiology of cardiovascular conditions and obesity, the biggest factor is what kind of food is available to consume for individual citizens, what kind of exercise opportunity is available to citizens, what kind of habits have we inculcated right from childhood. And for all these three, we need government intervention. One of the biggest public health success story is gradually government increasing its control over consumption of tobacco, and many countries it is banned. Many countries it comes with statutory guidelines that it should not be consumed. Every packet of cigarette now says it causes cancer. Now, as public health scientists, I am waiting for the day when every packet of sugar also contains a statutory warning that sugar can cause obesity, diabetes, cardiovascular conditions, and it can also cause addiction, just like cigarette. If we are so sure medically that sugar is not at all good, what stops a government to put such kind of statutory warning on every packet that contains sugar? Every workplace, can't we have a signage that for 30 minutes if you have been sitting in same posture, please move for at least 2 to 5 minutes. It doesn't really hampers productivity, rather it increases productivity. And it doesn't need any kind of investment, but it will go a huge way in controlling obesity, physical conditions, lot of joint problems. Again, government intervention, one go a warning and one go educational program across the workplaces and across the different public institutions. And the final and third thing about habits. If in new educational policy we also emphasize upon regular exercises at all the different level when learners are going either to school or college or higher institutions, if at every place we create opportunity 3 times a day for no less than 20 minutes of rigorous physical exercise, movements, walking, running, playing, and if we are able to build such kind of habit in our citizens, definitely the health outcome is going to improve. Definitely we can make a huge impact on obesity in country. We can make huge reduction in diabetes, and we can also reduce cardiovascular conditions. So as citizens and as public health professionals, we all should come together and request our government to come up with some concrete steps. Number one, all the food that is not good for health, not just cigarette, like trans fat, heavily salted food and heavily sugared food, it should come with statutory warning. Number two, we should encourage movement at workplaces. Number three, right from school days, we must focus on inculcating, changing new health habits. Let's see if we are able to convince our governments, we can definitely make India and world a better and healthy place. Thank you.